In this video, I'm bringing you a case of wrist pain. Today I bring you a very quick case of a patient that arrived at my clinic with wrist pain. This was a 34-year-old male patient, and he was training martial arts and he hurt his wrist. He couldn't remember exactly how he hurt it, he just knew that by the end of the training he was in a lot of pain. He described this pain as just moving the wrist would give him a pain between 4 and 5 out of 10. If he had to put any pressure on the wrist, like putting his hand on the ground to get up or something, it would go up to 7 or 8 out of 10. And the same thing if he tried to press on the areas that hurt, it would go to 7 to 8 out of 10. As the first step, I tried to determine as best as possible where the pain was, and after examining him, I realized that the pain was mostly in the area of lung 9. So all this area, but centered more or less around lung 9. As a start to treat pain, I always approach it with the balance method. So my reasoning was, if we follow the 3 steps of balance method, step number 1, determining affected channel, lung on the right side. Step number 2, determining which channel we're going to use to balance it. I decided to use system number 1, so spleen on the left side. And finally, we have to choose the points using images. I used a direct image where the ankle will represent the area of the wrist. So I know where the spleen channel goes, and I will look for acupoints around the area of spleen 5, and I placed needles on every acupoint I could find. It was about 5-6 needles. Also, on the opposite side hand, I decided to use a mais sobre point called Woohoo, or the 5 tigers. This is actually a set of 5 points in the thumb, and you have here 1, 2, 3, 4 and 5 points. There are many ideas about how you should use these points according to which kind of pain you treat. In my opinion, the best way to use them is to palpate all 5 points and needle the 3 points that are more tender for the patient. In this case, I ended up needling the 3 more distal points of this point set. To finish, I used YNSA, or Yamamoto New Scalp Acupuncture, and the saber or eye points, which are great to treat pain, and I use them on the same side, so in this case the right side, and we have here in this line at the end we have the eye point to treat the hand. So I applied the needle here in this area. Immediately after needling these points, I asked the patient to try moving his wrist, and he told me he had no more pain. I also asked him to try and press around the areas where it normally hurt, and he told me that he felt some discomfort, maybe the slightest bit of pain, 1 or 2 out of 10. I left the needles in for 30 minutes, and after I took the needles out, I asked the patient to try again, and again, moving the wrist brought him no pain. Touching, he could still feel the discomfort, but not really pain. And also, if he tried to put some weight on his wrist, he could feel the same discomfort, but no more pain. This was a very simple and easy case, but as most of you who already do balance method know, treating pain with the balance method is usually very simple. In this case, as I do in most cases in my clinic, I mix the balance method with mais sobre and scalp acupuncture to improve even further my results. If you like this kind of content, don't forget to like and subscribe. And also, if you want to learn more about the balance method, check out the course I have in the description. Right now the course is Portuguese only, but very soon I will have an English version available also.